oncologist. He's with us today. So welcome once again. Good morning to some of you if you're joining from the US or different part of the globe, and good evening to all of you. Uh, get
Good
set up.
evening.
Good evening. Good evening. Lovely to see you all. So, Get Set Up, as you all know, is a wonderful platform where we get to learn new skills, right from digital skills to sessions related to fitness, mental health, physical health. We have sessions related to singing, dancing, hobby ideas, and of course, as I mentioned, we invite guest speakers who are subject matter experts and they talk to us on this platform where we learn from each other. In case you are wanting a recording of this session, of course, we are live we are going live on Facebook. You can watch us. We are not going to pull out the video, so you can watch us. You can invite your friends to watch this session today. But even otherwise, if you need a recording, do write to us to help@getsetup.io, mentioning the name of the topic and the date. Those of you who are seeing us live this evening, welcome and warm good evening and good morning to some of you. And we encourage you to come to us, register with us using www.getsetup.io so that you can get to see a lot of other sessions that we are conducting. Get Set Up is not paid to promote any specific product or any service that we have. So, welcome once again, and let me quickly give a brief introduction of Dr. Donald Babu, who is with us today. He's going to talk to us on cancer prevalence and overview. Dr. Donald John Babu is a chief surgical oncologist, robotic, laparoscopic, and laser surgeries. He is MCA in surgical oncology from Tata Memorial Hospital. He is currently working as a consultant in the Department of Surgical Oncology at Reliance Hospital. He specializes in robotic and minimal invasive surgeries and organ preservation surgeries for cancer. He offers reconstructive surgeries to his patients using plastic surgery, which helps the patients get back to their normal self after the cancer treatment. He takes keen interest in driving this cancer awareness campaign in Navi Mumbai, especially for women cancers. But I have heard him and I have been privileged to host him on other platforms also. So once again, Dr. A warm welcome to you on this platform.
Thank you,
He
madam.
has multiple publications in various national and international journals to his credit and keeps himself abreast with latest developments in cancer treatment for the benefit of his patient. I would certainly want to pay my gratitude to Shubhangi Tirolkar, who's one of our ambassadors here at Get Set Up, to have, acquainted me with Dr. Ronald Babu. So very happy to host you here, sir. Platform is all yours, and I would like you to take it further from here. Thank you.
Yeah.
I would just want to tell our audience that we will be taking the question and answers to the last 15 minutes. So while he is talking, if you have any questions, do drop them in the chat box, and we will want you to be muted throughout the 30-40 minutes of his talk to us so that we can hear him out and then take the questions later on. Thank you. And all yours, Dr. Donald.
Thank you, madam. Thank you, madam, for that elaborate introduction. And I welcome all of you. Well, for us, it's a Friday evening, and most people are set into a holiday mood, especially with this weather outside. So I think I'll keep this topic really small because cancer is a huge subject, and it cannot be really covered in a matter of a few minutes. So what I'm going to do is I will just put in a few questions that most patients that walk into my OPD ask me. I think these are the layman questions, the general questions that they ask me. And to that, I will reply. And I think most of the doubts in your mind would be cleared. So I think the first question that most patients ask me is, why is the cancer incidence in today's world so much? Why do we hear about cancer so much? It wasn't so maybe 3 or 4 decades back, but why now? So to that, the answer is uh, our population is growing older. Uh, let's go back 40, 50 years back. People would generally die with infectious diseases like malaria, tuberculosis, uh, viral infections, influenza, and things like that. Now, with the advent of vaccination, with the advent of good medicines, we have a good control of these infectious diseases. So way back in the 50s and 60s, when we had malaria eradication program and the smallpox eradication program, that was the focus of the government, because at that time patients would die of these diseases. They wouldn't get older to have chronic ailments like diabetes or renal failure or things like that. Once we started having control over these infections, people started growing older. So 20 years back, the average lifespan of any Indian male or female was around 63 or 65. But today, that's not the case. We see people going beyond 75. And although this time census is yet to arrive, I'm sure the average age of Indian male or female will be above the age of 70. And that is the problem in the West, because in the West, people are growing older. And we have seen how these old people, you have seen the mortality in the COVID pandemic was so much more in the West. That is because people were much older there. They have a very good health infrastructure and they take good care of their older citizens. So once we started having good control over these infectious diseases, people started growing older. Now, when you grow older, you have other problems like heart problems, heart ailments, lung pathologies, asthma, COPD, diabetes related complications like gangrene, kidney failure, cataract, these kind of problems. Now, today we have amazing medical stents that are available, to the point that government has capped the cost of these stents. We have dialysis machine in every small nursing home that is located anywhere near you. We have got good medicines. So even those ailments, the chronic ailments, the ailments that happen over a period of time, like diabetes and the heart problems, we have a good control over them as well. So now we are growing older and older. And the biggest risk factor for cancer is age. I've mentioned that in every talk, and that should remove any kind of speculations you might have about the causes of cancer. Most of you think it's because of the food we eat, it's because we have lesser activity. They are contributory factors, but one of the most common cause is that we are an aging population. If you go to places like Japan, China, Europe, where there's an aging population, the cancer incidence are very high. The other reason is also that a few decades back, we never had the data on what was the incidence of cancer. Today, we do have the incidence of cancer. And in the last few decades, we have been very strict about noting down every cancer case that comes to us. So there's an apparent increase in the number of cancer cases, which is why one feels that there is a boom or there's a cancer epidemic, which is true to some extent. The second most common question that people ask me is, look, I don't smoke, I don't drink alcohol, uh, I don't have any vices. Why cancer? Why me? So again, to that question is, one could be age. Cancer is a multifactorial disease. There is no cause, one cause to it's not always that there is one toxin that causes a cancer. There are multiple reasons. So if I had to uh, um, tell you a point in case, uh, say breast cancer. Now, breast cancer doesn't really have any particular cause. There are so many reasons for breast cancer, and all of them, even today, are just postulates or hypotheses. It could be age, it could be the hormones, it could be obesity, it could be having lesser number of children, having lesser number of pregnancies. So these are the speculated causes of breast cancer. So breast cancers are multifactorial. Having said that, there are a few cancers which have certain causes. For example, cervical cancer in women. Now, cervical cancer, if you've heard about it, is the most common cancer among the women in our country, just in our country. So, cervix is the lower part of the uterus. Now, cervical cancer, the only reason for cervical cancer, which is found in 95 to 97% of the patients, is because of one virus called as a human papilloma virus. So that is one cause, one etiology causing a certain pathology, one cause leading to a certain pathology. So today we have introduced a vaccine for cervical cancer for the ladies. If you take cervical cancer, this decade has been declared by the International Cancer Council as the decade for eradication of cervical cancer. So by the end of 2030, we should be eradicating cervical cancer, at least from India. You don't see advanced cervical cancer cases in the West. You may not believe me, but even porn stars in the West, they have STD clinics because human papilloma virus generally spreads sexually through sexual contact. Although trauma, poor genital hygiene can lead to transmission of this virus, you need to undergo pap smears every 3 years, especially after you've started your first sexual contact. Till the age of 75, every 3 years, you need to undergo a pap smear to see if you're harboring some kind of virus. So uh, one may not even know that, okay, it's a human papilloma virus that causes cancer. In India, you have the oral malignancies. You know today that it's because of tobacco, it's because of gutka, it's because of other forms of tobacco like mishri or something like that. But do you know oral malignancies are also common in the West? And do you know what is the reason for oral malignancies in the West? It's because of the human papilloma virus. So all these are known etiologies causing a certain pathology. But there are other cancers like colon cancers. We do not know why it happens. Age could be one reason. It could be constipation. It could be bad bowel habits. It could be your bad food habits. It could be lack of exercise. So these are the causes of cancer. They are multifactorial, many causes. Some we don't even know. We are still studying them, like gallbladder cancer that comes in the northern part of India, which is the gallbladder belt, which is Rajasthan, Uttar Pradesh, Bengal, Bihar, Orissa. We call it the Gangetic belt, and we presume there is some toxin in the water of the Ganges that might be causing gallbladder cancer. So these cancers are multifactorial. We do not really know the cause. Just because you have a cancer doesn't mean God has punished you or something like that. It's a matter of chance. And remember, we all have to die one day. We all have to undergo some kind of pathology. We are not immortals. So there will be one day you will die of some or the other cause. Fortunately for us, our science has advanced a lot. We have pushed the average lifespan to 70, 80, which is kind of an achievement. We must also remember there are a lot of environmental causes that we are not aware. For example, depleting ozone layer, the pollution in the air, environmental pollutants, food toxins. There are so many things that are added in the junk food. We are not aware of these things. Also today, most people are staying indoors. There is a lack of exercise, physical activity. There is a lack of sleep. People sleep for lesser and lesser hours. The one thing that I truly appreciate among our Bollywood stars is they're always posting something on Instagram with relation to their gym workouts, in relation to what they eat, how they train themselves in the gym. It is something that I really look forward to because it inspires me as well. And today, even I have started running for 30, 40 minutes a day so that there is no excuse because health, forget cancer, health is something that is very personal. You need to take care of every aspect of your body. It starts from your hair, it goes down to your skin, your teeth, your nails. It doesn't start and end with the muscles alone. So everything from your heart, from your genitals, everything needs to be taken care of by you yourself. No one else can tell you, not your spouse, not your daughter, not your mom, not your dad. You need to take care of your own health. And it is very vital that you visit your physician, a pathology lab, annually every year. You get the required tests. I'm especially I would encourage the people above the age of 50 to meet your physician to get most of your annual checkup done, because what we have seen is that people who come to the clinics for their annual checkups are the ones who do not have a problem. The ones who generally have a problem are the ones who never visit a physician, because the ones who visit a doctor are, they're generally very self-conscious about their health. So they take their precautions, they listen to health talks, they follow the health talks. And um, one thing that I've seen among most people are the third part of the question. The third question that most of them tell me is, I do a lot of physical exercise, which is walking. Now, I can understand walking after the age of 70. If you're 50, it is not something that I would advise you to do. At 50, you're supposed to run, you're supposed to jog. You're not old. Any age is just a number in the mind. So if you think you're old and you need to walk for physical activity, I would say that is preposterous. So it is important that all of you have some kind of physical exercise, physical training, good sleep, and good food. So these three things are free. You don't have to pay for it. You don't need an advice on it. You already know it. But most of them come and ask me for some medicines, some vitamins, some expensive medicine, some medicine that will reduce your weight. I'm giving you three advices which are free: just food, timely food, good sleep, and physical exercises, which is something that you don't even have to pay your gym. You just have to run. So, why the number of cancer cases are increasing? Why me? Why me with cancer? Uh, what are the causes of cancer? And the fourth question is, I have heard in some WhatsApp forward or on Facebook that this alternative medicine helps. So, for example, Ayurveda, homeopathy, some Chinese herb, uh, turmeric in water. See, if cancer was due to one particular cause, it would have helped. But like I mentioned, cancer is multifactorial. There is no one medicine that can help you. Hence, when we treat a patient, we have it's multimodal therapy. We give patient surgery, we offer the patient surgery, we offer the patient chemotherapy, we offer the patient radiation. When we give chemotherapy, we add two or three medicines together, because cancer cells have their own mind. They can change their genes if they realize that through this cell, the chemotherapy drug is entering. They close the gate for the chemotherapy medicine. So we generally try to give two or three medicines so that the cancer doesn't get resistant to these kind of drugs. So it is a multimodal therapy. There cannot be one single solution to any kind of cancer. There are herbs, there are vegetables, plants, Tibetan medicine, uh, old Ayurvedic treatment available. You can have that. But because these things don't have any scientific basis, we do not encourage patients to have this. And I think as educated people, we should not fall for this kind of therapy. You must have heard of some patient having this medicine and he's completely all right. Most of these stories are untrue and you should not fall for it. So the best thing you can do is find a good physician near your locality, ask his advice, go for the scientific treatment. You can now, Google is available. You can always find out if the advice given to you is correct or not. You can always take a second or third opinion. So alternative medicine is something that I wanted to emphasize on, because that is one question most of you ask me. Along with cancer therapy, one should always uh, go for a good diet, have a good sleep, and continue yoga, meditation, or some kind of physical training. I have some more time, and I have mentioned this story in my previous talk as well, and I am going to mention it again. I'm going to give you um, a story of my personal journey in cancer. So it was my father-in-law who was diagnosed with cancer of the food pipe, and cancer of the food pipe is a very dangerous cancer. Only 50% of the patients make it, which means 1 out of 2 will generally succeed in getting cured. Uh, Now, I wanted my father-in-law to be among the one who would survive the cancer. Now, cancer esophagus, which is cancer of the food pipe, is treated by giving chemotherapy in the beginning, followed by surgery, again followed by chemotherapy. So I wanted my father-in-law to do something different that would get him out, that would make him successful. So when he was diagnosed with cancer of the food pipe, the first thing I wanted him to do, he was a smoker. He was a chronic smoker. He would smoke 2 packets every day. So there was no question of asking me why did I get cancer. We knew that this was the reason for cancer. He escaped his heart disease. He escaped his lung problems, but he got cancer at a very early age of 60. So when he was diagnosed with cancer esophagus, the surgery entails cutting open the thoracic cavity, cutting open the abdomen, and removing the stomach and the food pipe. So I had to build his physical strength. So what I did was I got in a physical, my gym um, coach, the coach at the gym. I got him home. I told him I need you to train him every alternate day to build up his core strength. I want my father-in-law to build up core strength. He had never gone to a gym before. He had never done any kind of physical training. I wanted him to build up his core strength. So Monday, Wednesday, and Friday, he would come home to build up his core strength. I also wanted him to have some mental peace. So I called a yoga instructor who would come home on Tuesdays, Thursdays, and Saturdays. So physical part is taken care of, the mental health part is taken care of. Third, I called in a dietitian. Now, the doctor didn't advise me. I was young at that time. I was studying for my medical degree. Uh, this is something that I thought of as a doctor. Uh, I also got a dietitian. Now, because the food pipe is cut, the stomach is cut, the stomach becomes small in size. I modified the diet. So instead of having 3 meals a day, he was having 6 meals a day. Small diets, high protein diet, high calorie diet. So diet was taken care of. Then was I installed a music system in the house. So every morning at 6 a.m., some kind of classical music would play. He was not fond of it. I just put it. Fifth, he was very fond of it. He had a big mustache, and he had a good tuft of hair on his head. He was very fond of it. I knew chemotherapy, he would lose it. So I bought chemo caps. I ordered specifically chemo caps from UK, which I'm using it for my patients here. So now everything is here. Now you start treatment. It so happened that on the first day after the first gym session, Monday it started. Wednesday, when he came back, he said, "I'm sorry, I don't want to go to the gym. I'm feeling very tired. I don't want to go." He started giving excuses. That was the first month of chemotherapy. At that time, his weight was it had come down to 64. A month later, 1.5 months later, it so happened that the gym instructor, instead of coming at 6 o'clock, he came at 6:15. My father-in-law called him up. he shouted at him, "Where are you? Why aren't you on time?" So you see, my father-in-law started getting addicted to exercise. He realized that he was gaining some strength. There are these endorphins that are released in your body. You feel good about exercising. So it got so addictive that my mother-in-law, who had never exercised, she also started joining him for simple exercises like jogging, lifting weights, just core strength building. They got so used to it, and they are so addicted to yoga and physical exercises that they continue it to this day. So after the surgery, his weight came down to 57, something like that, because he had undergone some surgery and stress and all that, after which we again started him with chemo. Today his weight is 74. He's 6 feet tall. His weight is 72. Before COVID, he had gone to New Zealand for a vacation. He became that one out of the two who survived the disease. So it was not just about chemotherapy, not just about surgery, not just about radiation. It was all that paraphernalia that I added to his treatment, I believe, helped him sail through the disease. So that is the importance of physical exercise, diet, good sleep, positive attitude, positive mental health, removing stress, at the same time taking scientific evidence-based treatment to your pathology. So with that, I would like to end my session. I've seen a few people punching in a few questions. I'll be glad to take them now.
Yeah, thank you, doctor. And yes, I really had requested you to give some extra time for the questions, and I'm glad that you have kept it, because I'm sure our audience would have some questions, and I would invite people to raise their hand if you have your questions, and Yashri, my colleague, will help to unmute you or call out your name, and we can take the question one at a time, and try and stick to generic kind of questions rather than going to personal questions. Okay, so
Right.
so that it can help everyone else also. Yes, Manjushri
Right.
has raised her hand. Manjushri, आप unmute करके पूछ सकती हैं.
Okay, ma'am. Good evening, doctor.
Yeah, good
Actually,
evening, madam.
can you tell me, please, whether cancer is a heredity or what? Actually,
Okay.
my father-in-law was having cancer. My brother-in-law
Right.
was having cancer. Even my husband was having cancer. So
Right.
I'm bit getting frightened that my son should not get that thing. So I'm asking you this thing.
Right. That's a very good question. See, hereditary cancers are very common, and nowadays we are picking a lot of hereditary cancers in India as well. Now, every cancer, there is a certain criteria for hereditary cancer. For example, breast cancer में पकड़ लो. If a patient comes to me with breast cancer, if she says my mother had cancer, say breast cancer or ovarian cancer, and my sister also had breast cancer, which means there are two primary relatives with cancer. So the criteria for breast and ovarian cancer is if there are two primary relatives. Primary मतलब खून का रिश्ता, direct खून का रिश्ता, cousin नहीं, बहन, माताजी, बेटी. This is primary. So ऐसा कुछ रिश्ता है, then we say okay, go for genetic testing. If you tell me my mother had or my aunt had, that is, वो तो ऐसा कनेक्शन रहेगा ही, हर फैमिली में किसी ना किसी को तो कैंसर रहेगा ही. That doesn't mean आपको हेरिडिटरी कैंसर है. सिर्फ इतना कहना काफी नहीं है कि कैंसर है. कौन सा कैंसर है? अगर आपके पिताजी को मुंह का कैंसर था, तंबाकू डाल के कैंसर था, वो हेरिडिटरी क्यों रहेगा? इट वोंट बी हेरिडिटरी. सो समथिंग लाइक कोलोन कैंसर, breast cancer, ovarian or uterine cancer, some upper GI cancers like stomach cancer, liver cancers, these are hereditary. All cancers are not hereditary. कब टेस्टिंग करना चाहिए उसका हर चीज का एक क्राइटेरिया रहता है. जैसे कोलॉन कैंसर, राइट साइड कोलॉन कैंसर विद अ सर्टेन पैथोलॉजी लाइक म्यूसिनस ट्यूमर बिलो द एज ऑफ 50, अगर आपको है तो हम, हाँ, प्राइमरी रिलेटिव्स, आपके हर फैमिली मेंबर में हम चेक करेंगे. आपके फादर इन लॉ को कैंसर था, हस्बैंड के रिलेटिव को कैंसर था, आपको तो कैंसर नहीं होएगा, बट आपके बच्चों को चांस है. बट क्या कैंसर है वो भी जानना जरूरी है. अगर आपके फादर इन लॉ को लंग कैंसर था क्योंकि वो सिगरेट फूकते थे, दैट कैन नॉट बी हेरिडेटरी, राइट? इट कैन नॉट बी हेरिडेटरी. इट इज क्वाइट पॉसिबल कि आपके फादर इन लॉ सिगरेट मारते थे, घर पे बैठ के मारते थे, तो वो पैसिव स्मोकिंग की वजह से आपके हस्बैंड को भी हो गया या उनके भाई बहन को भी हो गया. इट इज क्वाइट पॉसिबल. सो दिस इज समथिंग दैट अ फिजिशियन विल टेल यू कि वो हेरिडेटरी कैंसर है कि नहीं. बट येस, हेरिडेटरी कैंसर्स आर कॉमन in our country.
Thank you very much, Doctor. Thanks, Manju, for asking the question. Pratima ji, you can unmute yourself. Pratima Rai.
Yes, thank you for this opportunity. Doctor,
Yeah.
I have two queries. One is
Yeah.
concerning the vaccination that you mentioned, cervical
Right.
vaccination. Is it safe
Right.
to take it? That is one
Yes.
query. And the other query is, I'm wondering, is there a correlation between cancer and a blood group?
Right. So cancer and blood group, they can be an association, but there is no correlation. As in, there is no cause association. There can be we can say that a lot of stomach cancers are O positive, but that doesn't mean the corollary is true that O positive patients will get stomach cancer. It is just something that we have seen. Something like saying ki in 1995, when the banana exports in Orissa had risen, the GDP also increased, which has no correlation, but something that we observed. Okay, so there is no association between cause association between blood group and cancer. Number one, that is a take-home message. Nothing to do with blood group nothing to do with blood group has anything to do with cancer. So that answers your question. Second, what is the second question? I'm sorry, I forgot.
Vaccination. Is it safe to take?
Yeah, right.
And what is the cost?
Of course, vaccination is safe to take, and vaccination is generally advised for children between the age of 9 to 26 or to the age of first sexual exposure. If you are 50 plus, 40 plus, and you are in a monogamous relationship, and so is your spouse, you still can take cervical cancer vaccine. So why we emphasize on sexual exposure is because the human papilloma virus passes through sexual transmission. So if you have taken the vaccine after your sexual exposure, it is quite possible virus. The vaccine may not help you. Again, let me tell you in another perspective, HPV vaccine is ubiquitous. It is present everywhere. You might have got the human papilloma virus before also, but 99.99% of the times, the body will destroy the virus. Among the 0.001% that it stays in your body, there is a 99% chance that you will not develop the cancer, that you will not develop anything. It might just present as cervicitis, some kind of bleeding, right? So there is a very, very small chance that the virus will cause the cancer. But if you have the cancer, 99% of the times it is because of human papilloma virus, which is the most common cancer in India. Can you believe it? A virus is causing the most common cancer in India, which is so avoidable. Most common cancer in India is mouth cancer because of tobacco and gutka, which India is a unique country. Only India has mouth cancer. None of the countries have mouth cancer. So these are avoidable cancers. And we are dealing with such a huge amount of load of these cancers. Vaccines are absolutely safe. If they were unsafe, they would have never been introduced. So vaccines are always safe.
Thank you. So Aruna had a message in chat, but I think it was already covered in your story when you shared about your father-in-law. Does smoking cause cancer? And
right. No doubts about it. Smoking causes cancer. But smoking causes other ailments like heart problems, lung problems. So if you escape all that, you can also have cancer.
Yeah, Aruna, you want to unmute and ask? Yeah, you're raising your hand. Just unmute and ask your question. You have to unmute, Aruna. You haven't unmuted. Unmute kiji. Yeah.
Okay.
Hi. Tell me.
No, you went back. You muted yourself again.
Okay. Good evening, doctor.
Yeah, good evening.
Yeah, I want to know whether how can this breast cancer comes? Reasons for breast cancer?
Right. So I think I mentioned in my talk, right? There are no reasons.
I
There are
came
only.
little late.
Oh, okay. All right. Just for you, I'll make it really quick. There are no reasons for breast cancer. Although breast cancer is very common among the urban women, many theories have been postulated, like use of deodorants, the material in the bra, your blouse, but none of them have proven to cause breast cancer. All are postulates, some relation between the hormones in your body, excess hormones in your body. That could be because of obesity, which happens after menopause. It could be because of excessive cycles of the menstrual cycle. So, which means that if you have more pregnancies in your life, you have lesser number of menstrual cycles. That means lesser exposure to estrogen and progesterone, which are the hormones which can cause cancer. But per se, no reason. What you can do is you can get your breasts screened for cancer every year after the age of 40. So after the age of 40, my mom does it. You all should do it. You all should go for your mammographic screening every year, whether you feel a lump or not.
Thank you, doctor. That was, yes. Most of the time, we are not really wanting to go every year. And thank you for sharing that, because pap smear and mammography, people don't take it seriously. And I think we should be doing it.
Right.
So, and anyone else who has a question can raise your hand. Manjushri, I'll just come back to you. Agar aur kisi ka hai, to we can take that question before we are back. Yeah, Manjushri already had put, my husband was having stomach cancer, and so should I ask him to do testing? So your question is about ask your son to do testing. Manjushri, is that your question? We then come to Shruti Kodkani.
No, you don't have to test anything for stomach cancer per se. There is no indication that the family had stomach cancer. So not really. I don't think you should undergo any kind of testing.
Yeah, thank you. Yeah, Shruti, you can unmute and speak.
Yes, thank you, doctor. That was a very good talk, and you made it very simple. And that was the whole idea of attending this your session. In fact, I asked my sisters, but they were like, "No, I don't want to know about it." Because yes, we do have we had cases in my dad's side as well as my mother's side. What I would like to know is, doctor, like, okay, we do pap smear and breast mammography and all, but is there any other kind of a test to detect cancer? Is there, I mean, there, like you said, there could be so many organs which could get affected. And if there are no symptoms, how do you know? Like, we take annual health checkup. So is there anything like that that could kind of pre-warn us?
We have a cancer screening programs. I've already mentioned that in my previous talk. I mean, of course, I didn't mention it here. So other than the mammogram, they say for the ladies, we have the mammo, we have the pap smear, we have the tumor markers, which is for the ovary, for the colon. We do stool for occult blood for colon cancer. We take a chest X-ray. We take a sonography of the abdomen. That would probably clear all the organs in the abdomen. We also send sputum for cytology, urine for cytology. It all comes in a cancer screening program. It's there in my hospital. I don't know about the other hospitals. So in fact, April, I think, was the cancer awareness month, and we had it at a very subsidized cost of some 2,000 rupees. All these tests were done. So I think many of the people got it done here. I think I'd mentioned it to Madam also the other day.
Yes, you did. I remember that. And yeah, then and in his hospital, in fact, when it happens again, we will surely announce it also on this platform, because as I mentioned in his introduction, he has been working a lot on this awareness sessions across the state and the city, of course. So yeah, thank you, doctor.
Thank you so much.
If you have around 50, 60 of you coming together in a group, then again we can give it in a subsidized fashion for, on one particular day, you can just organize yourself, come to our hospital and get it done. You can do it in a subsidized fashion.
Thank you, doctor, for that. So Carol wants to know, is there a blood test to detect cancer? You talked about the other tests, but is there a blood test?
Yes, there are tumor markers for CA ovary, like CA125, CA19.9, even for colon cancer. But these tumor markers are raised in advanced disease, not in the early stages of the disease. Other than that, there are labs that are advertising, like the Datar lab, and there are other labs, commercial labs, of course, who are advertising we can pick up circulating tumor cancer cells. They are not proven. So we do not advise, and we wouldn't like you to go through them, because they will unnecessarily psychologically affect your mind if something turns out positive. So there are simpler ways to do it, less expensive ways. Like I said, the routines of cancer screening programs. There is no one blood test that will detect cancer in your body. No.
Yeah, thank you. Girija, I'll just come to you. We'll take two questions and after Girija, Henry. Let me just take two questions from the chat box. Lorraine was wanting to know, is pap smear test required if hysterectomy is done?
That's a very technical question. Lauren, I don't know if you've asked it knowingly or unknowingly. So human papilloma virus can cause cancer of the vagina as well. Now, vaginal cancers are very, very uncommon, number one. Number two, most hysterectomies include removal of the cervix, but sometimes the gynecologists, if you have a fibroid of the uterus, sometimes they leave the cervix behind. So a subtotal hysterectomy. In fact, when I was a medical student, my gynec would only do a subtotal hysterectomy. So pap smear, once your hysterectomy is done, pap smear, whether it should be done or not, is questionable, but I would still advise you to have a pap smear done if you're not sure what kind of hysterectomy has been done. Vaginal cancers are very uncommon, very, very uncommon. If I know the cause of hysterectomy, suppose the hysterectomy was done for a fibroid, then maybe I would tell them, okay, not required. Maybe once in a while you can go for it, not as a routine pap smear. But if I don't know what is the cause of, because most of them tell me, I was bleeding, so they did a hysterectomy. So I don't know the cause of hysterectomy, then I would advise for a pap smear. Good, that's a great question, actually.
Thank you. So we'll take Girija and then we come to Henry before we go to Shruti. Okay, Girija, you can unmute and ask your question.
Doctor, I just wanted to know, I'll just tell you the example and maybe I'll be able to, address it better. If I have a friend who had some urinary tract infection, that's what she went to a physician. So they did all the tests and they told her it is a urinary tract infection, and they has a lot of, heavy treatment for that. They put her on antibiotics and all that. But still, she said she had a prickly feeling and very much a lot of irritation and all that. So then she further went to another urologist, because she found out that with all this treatment, it was not happening. It was not set right. So she went to a urologist. Again, he also, they went through they got all the tests done. And then now, even after the treatment that he gave, she still has the same problem. So now, as a next step, should she go to the oncologist?
No, why should a urinary tract infection mean cancer?
What is the path?
She can get a sonography done.
No, she
maybe a
was
cystoscopy
doubting.
done.
It seems all that
No,
was done.
Yeah, so if there's no cancer, then why to meet an oncologist? She can get if nothing has been found, she can primarily get a scan done to see if there's any pathology inside. If there's any mass, is there any swelling, any ulceration, any biopsy required? If nothing else, then
She said, in
I
spite
don't think
of
cancer is a cause.
all the heavy antibiotics and all the treatment,
Yeah.
she doesn't
Yeah,
find
but that doesn't
any
mean it's cancer.
the same,
That doesn't mean
relief.
it's cancer.
Yeah.
So she was worried
Girija,
that
I think Girija,
it
can
can't
we
be, no?
can we move on to the next? We have a few questions and hands raised, so we will just move on to the next question. Henry, you can unmute yourself. Yes.
Doctor, it's colon cancer in an advanced stage, say people over 50 or something. If it is surgery, the part is removed, and then if they want to again join the colon, and how good the survival or the
colon cancers are very good, uncle. Absolutely fantastic survival rates, even after they have spread. And patient has no problem. No change in quality of life, nothing.
Yeah, that's a very
colon cancer,
positive answer.
Yeah.
After the surgery, like if they are like
no problem. Colon, breast, kidney, thyroid, mouth cancer, ovarian cancer, good cancers. Bad cancers are esophagus, stomach, liver, gallbladder, lung, bad cancers. Brain, bad cancer. Rest all are very good cancers. Even among the stomach, esophagus, lung, liver, if you come in the first stage, good cancers. My father had liver cancer, gone, full, finished, done. He's absolutely fine. My own father. I didn't even have to operate him. All that I did was, it was a routine sonography. We detected the cancer. I just burned the tumor. I just put in a probe, burnt it, finish.
That's so encouraging. Thank you.
That is the importance of screening. That is the importance of going to a physician, getting yourself screened, picking up tumors in the early stage. No need of any chemo, no radiation, no nothing.
Thank you, Doctor.
Yeah.
Thank you, Henry, for asking that. And Doctor, yes, it's very encouraging to hear that about the good cancers and the bad cancers. So Shruti, yeah, you can make a quick question, and then we have some questions in the chat. I shall go there. Yeah. You have to unmute yourself, Shruti.
Doctor, symptom of liver and kidney cancer?
They don't have symptoms. That's why you need to, unless they're very advanced and you find a swelling or something like that, these tumors generally don't have symptoms. Kidney tumors might present with blood in urine or something like that, but you need to screen yourself. You need to get a routine sonography done, urine for cytology, like I mentioned. The urine will pick up kidney tumor cells. Liver, nothing. Liver always comes in stage 4. Always. Can you imagine? My dad came in a stage 1, earliest of the stage 1 diseases. So liver never comes in stage 1 disease. It's always picked up in stage 4, stage 3. Even in fact, today I saw a stage 4 liver cancer.
So Doctor, your family has been lucky actually. Your family has been lucky because they know there is a doctor there in the family. Your dad and your father-in-law.
No, you got me all wrong. No, not lucky. We are just, it's just being prudent and knowing that you need to go to a physician. You need to get your annual test. I'm telling you that. Get yourself checked every year. That's all you need to know. Not lucky, not because I'm a doctor. You got a sonography done. We detected the tumor. We burnt it. Work done. It's just an annual sonography. That's all that is required.
Yeah.
Thank you.
Thank you.
It's as simple as that. It's as simple as that.
Yeah. So Reena, your question in the chat box, it may not be appropriate to take up here. Which labs are better to go for any kind of health packages? We will not take that question. Leena also mentioned that 6th June was National Cancer Survivors Day. And we are having this session in the month of June. As I said, at Get Set Up, we try to bring in the topics, especially when they are connected or there is a theme associated. So thank you, Leena, for mentioning that. And Jayant Basu mentions blood cancer is very common in children in our country. Any particular reason?
Yeah, blood cancers are common in children only. I mean, they are common in the children. The reason being, children have a lot of growing cells, and growing cells are the ones that have mistakes. And when I mean mistakes, there are genetic mistakes. So, like any child does a mistake at home, their growing cells have mistakes in their genetic attributes, and that's what leads to cancer. So, children have a lot of blood cancers. They have a lot of brain cancers. They have a lot of kidney tumors. These three are the most common cancers among children. And I would personally advise, if you know any child having any of these cancers, straight away send them to Tata. Don't send them anywhere else. It's free treatment in Tata. There's a lot of money coming in for the children. It's free treatment. It's free. None of the other cancers I would advise Tata, but for pediatric cancers, I would always say go to Tata because it's free. And blood cancers are very expensive treatment. You cannot take it anywhere. You cannot take it in a private hospital. It's very expensive. It's to the tune of 20-30 lakhs. So I would always advise children having cancers. I would always advise Tata. Adults having cancer, I will never advise Tata because there's a long waiting list and you will just get frustrated, and that kind of affects your psyche. You know, you're just waiting in the line. You don't know whether you'll get all right or not. You don't know when it'll be a number. So I generally don't advise Tata for the adults. But if it's pediatric cancer, blood cancer, or any of those cancers, straight go to Tata. It's free treatment. You don't have to pay a penny.
Thank you very much, Doctor. So the last question in the chat, Pratima Rai, will CBC test showing high WBC can be considered as a marker? What is the cutoff point beyond which it should be alarming?
No, nothing to do with cancer. CBC has nothing to do with cancer. Unless it's leukemia and your counts are more than 1 lakh. Yeah, normally its counts are between 4,000 and 11,000. But a high WBC count only shows infection. That's all. It's not cancer.
And what about bone cancer? Good survival chance is the question.
Bone cancer depends. Bone cancers, most of them are good, except for the ones in children. It's a long process. It's almost a year of treatment. That's why I wouldn't advise a private hospital for children.
And lymphatic cancer surviving rate? Is
what
the
cancer?
Question from lymphatic.
No, there's no such cancer. Lymphatic. I think somebody has just picked up some word somewhere.
Okay. All right. So thank you very much. This was a wonderful session. A lot of awareness and information. Insightful session, I should say. So as we summarize or gather, it's what he has brought. It boils down to a good lifestyle, which consists of, you are responsible for your own health and the physical fitness that most of you are already working towards, a good diet, and of course, a quality sleep. These are the three things I think what he mentioned to focus on, and not to forget that each one of us is responsible for our own health. So thank you once again, Doctor, for this wonderful session here.
Thank you, madam. Thank you for this opportunity.
I want to thank all the participants for having been here, and all the audience and those who are listening to us live on this platform. We are happy that you could join us, and you can look us up at www.getsetup.io to look for more such wonderful sessions. You can register and do invite your loved ones who can also get benefit from these sessions. Once again, thanking Shubhangi Tirolkar also for having referred Dr. Donald Babu. And once again, thank you very much, Doctor. We might invite you here on this wonderful platform sometime in the coming months also. Bye-bye.
Sure, madam. Bye-bye.
Don't forget to give the feedback. Do talk about it on your social media platform. If you're on WhatsApp, if you're on Instagram, if you're on Facebook, tag us, #GetSetUp, and talk about what you learned in this session. Shubhangi, ma'am, you want to say something before we close? You have to unmute.
Yeah. Thank you, Binda. I will just take an opportunity to say here that as doctors, you have to do the yearly screening. I make it a point that all our friends, they do the screening during the month of March, 8th of March.
Right.
Make women, whoever in your family, your friends, you take that. It's a simple job. And I know many people, including me, who has been, fortunate to.
Yes.
Yeah. So that is what I'll request. You have to help others to go through this test. That's all. Thank you very much, Dr. Gunnar.
Thank you, madam. Thanks a lot.
Thank you.
Bye-bye.
Bye-bye, everyone. Take care.
Bye.
And be safe. Thanks,
Thank you,
doctor. I
doctor.
don't know whether Sapna was here. I
Thank
didn't
you.
see her. Thank you. Bye-bye. Thanks, Yashvi, for
Thank
being
you. Thank you, ma'am.